A longtime patient of mine, Linda, asked me this question. My 15-year-old is starting to ask me questions about her period and birth control. Plus, she is so moody. She has a boyfriend that is a year older, and I'm not sure if she is sexually active yet. When do I bring my daughter in for her first gynecologic exam? Let's face it, when it comes to talking to our daughters about birth control, safe sex, and preventing sexually transmitted infections, this conversation ranks right up there with being one of the more awkward ones. So many moms over the years have worried that once they bring their daughter to see me and potentially get started on birth control, it will give them permission to become sexually active. I don't think that having your daughter see a gynecologist is the catalyst for our kids having sex. Now, here are a few tips to help ease you into the discussion and experience with your daughter. The current recommendation is for girls 13 to 15 of age to see their gynecologist for screening, preventative services, and other healthcare guidance. During this visit, a consultation and/or an external examination is performed to make sure everything is where it should be. The focus of this visit is on education for the daughter and developing a doctor-patient relationship and an open discussion about self-confidence, body image, weight management, vaccinations such as the HPV vaccine, contraception, and prevention of sexually transmitted infections. I also like to have an age-appropriate discussion about female body development. Parents and healthcare providers have to help adolescents know that they have a supportive environment and a place to go to talk about sexual and reproductive health. A very interesting study came out of Duke University showing that 1/3 of teens did not ask questions about sex or discuss their sexual activity, sexuality, dating, or sexual identity during their yearly checkup. The same study showed the topic of sex was brought up 65% of all visits, but the conversation only lasted 36 seconds. The earlier the dialogue begins, there's a better chance our teens have to avoid sexually transmitted infections, unwanted pregnancies, alcohol, tobacco, and drug use, and live a healthy lifestyle.